Hi everyone, my name is Alice Snow and this is my DNP project titled Treatment Adherence Using Check and Follow-Up Calls at One Outpatient Mental Health Center, a Quality Improvement Project. First, I'd like to start by identifying and giving thanks to my DNP committee, starting off with my Maryville University Chair, Dr. Teresa Gallicatos, my community person, the Chief Nursing Officer for the County of Los Angeles, Department of Mental Health, Dr. Luann Anderson, and the second reader, Dr. Lisa Stewart, who is an adjunct faculty here at Maryville University. Next, I would like to share some of my credentials. I obtained my BSN from West Coast University in North Hollywood, California, my MSN from Maryville University in St. Louis, Missouri. I am currently a board-certified psychiatric nurse practitioner licensed in the state of California, and now I am a DNP student here at Maryville University. First off, I'd like to start by introducing some statistical numbers with everyone. The Center for Disease Prevention and Control reports that 20.9% of Americans suffer from mental health illnesses. The coronavirus disease in 2019 did have a negative impact towards mental illnesses, showing a 13% rise in mental health and substance use disorders. People that suffer from severe mental illnesses, they do die prematurely with a timeline of passing away almost 2 decades earlier due to preventable physical conditions. Worldwide, schizophrenia affects approximately 24 million people, or 1% of the worldwide population. Yet approximately 70% of this population does not receive any form of treatment. Patients with schizophrenia are at high risk for treatment non-adherence. So to promote an increase in treatment adherence for adult patients that are newly diagnosed with schizophrenia, follow-up calls to patients as a reminder of their upcoming scheduled medication appointment was determined to be an effective strategy for treatment adherence. Next, I will review the purpose and aims of this DNP project. This quality improvement project aimed to explore whether follow-up care was positively impacted when patients is called by a live person to encourage them to adhere with their follow-up medication treatment. A call from a peer volunteer may positively impact the patient's desire to attend their follow-up appointment and be more involved in their treatment planning. On this slide, I would like to share with you all my DNP question, which is: in patients with schizophrenia, do follow-up calls compared to no follow-up calls increase treatment adherence over the timeline of 6 months? Next, I will be discussing Rogers' diffusion of innovation theory, which was the theoretical framework for this DNP project. There are 4 key elements in this theory, starting off with innovation. So the adoption depends on the originality, the compatibility with values, and simplicity of the innovation. The triability, which allows testing before full adoption of the innovation. Next is communication channels. Information sharing does help people understand the innovation, where influencing their decision whether to accept or reject it. Next is time. Adoption varies over time. As individuals, they form attitudes and may inspire others to adopt or reject the idea. Lastly, for social systems, external and internal influences, such as the media, mandates, opinions, leaders, it all affects the spread and acceptance of the innovation in society. This theory was utilized for this DNP project, as new patients, they do take time to determine whether they will continue their services. In addition, mental health follow-up care has always been difficult for patients with schizophrenia, especially keeping their appointments and adhering to their medication regimen. So instead of expecting these patients to remember their appointments, follow-up calls and appointment reminders can assist the patients in adhering to their medication follow-up appointments. Utilizing the elements of Rogers' diffusion of innovation theory, for an innovative practice change which can offer a great opportunity to improve patient outcomes, it can include peer communications that encourage adherence to follow-up appointments. Okay, now I will review the themes of the literature. There are 3 themes that were noted, starting with the first one, which is adherence to treatment status post-discharge. Patients with schizophrenia, they do face a significant challenge in adhering to post-discharge treatment, which is impacted by factors such as substance abuse comorbidities, lack of discharge planning, stigma, and trust issues, which can all lead to readmission. So supportive follow-up care can really impact treatment adherence. Next would be the importance of follow-up care with the provider. Timely follow-up care after discharge can reduce readmission rates, support treatment adherence, and help prevent relapse in high-risk patients, especially those that are newly diagnosed with severe mental illnesses such as schizophrenia. Lastly, there's improving patient outcomes. To improve patient outcomes, timely follow-up care and strong patient clinic report can improve treatment adherence and reduce readmission rates in schizophrenic patients just by enhancing the patient's insight, their coping skills, and medication adherence. Next, I would discuss the methodology on how this project was conducted. This project is a comparative quantitative research design which was implemented using a retrospective chart review of the electronic medical records, or EMR for short. The retrospective chart review included 60 EMRs within the date range between January 2023 to June 2023. The analysis of this EMR determined whether a patient received peer volunteer calls was a positive impact to adherence with their scheduled appointments, and then a review of the peer documentation was also implemented to determine whether patients received a live phone call or not. Now, I would discuss the inclusions and exclusion factors. For inclusion criteria, this was all through the EMR system. The EMR must include the patients that are older than 18 years of age. The EMR must also include a diagnosis of schizophrenia, paranoid schizophrenia, disorganized schizophrenia, or unspecified schizophrenia. Next, the documentation must also include this patient status is a new patient starting from October 2022. The EMR must also include that the patient has already completed their initial psychiatric evaluation and has scheduled follow-up. And then next, the EMR must also include that the patient, either they've received or they have not received a call from a peer volunteer, and then what the documentation of the peer volunteer was. The EMR must also have a documentation on the patient's prescribed medication route, which could be oral, injectables, or both. And then lastly, the EMR must also include that if the patient has been admitted to an emergency department, if they were placed on a 5150 hold, or they were admitted to a acute psychiatric inpatient facility. For exclusion factors, so these EMRs were excluded as followed. The patient is younger than 18 years of age. The EMRs did not include a diagnosis of schizophrenia, paranoid schizophrenia, disorganized schizophrenia, or unspecified schizophrenia. The patient was not a new patient before October 2022, and they were not a new patient starting February 2023, which is both out of the timeline of this project. On this slide, I will be reviewing the data collection process. The data was collected, was identified from the clinic's EMR system. The clinic's medical director provided myself with a patient list with a diagnosis of schizophrenia, disorganized schizophrenia, paranoid schizophrenia, and unspecified schizophrenia through an Excel workbook. I then examined each EMR to collect data and transferred that data onto another Excel spreadsheet. A total of 60 EMRs was reviewed, and then the peer volunteer data was reviewed. The data that included from the peer volunteers for their follow-up interaction was either the peer volunteer had a live contact with the patient to either speak to them or reschedule. There was no contact via no phone call, or there was a message left. This data was reviewed and data was extracted. Data also included the route of medication the patient was taking, such as oral, long-acting injectables, or if they're on both, and their adherence status. Next is the information was gathered in an Excel spreadsheet for analysis to assess the follow-up effectiveness. Okay, now I will review the data analysis of this DNP project. This DNP project was a descriptive research design comparing one group who received live person phone call contact compared to another group who did not receive a live person phone contact. The data collected from the EMRs were medication adherence and the type of medication prescribed. For this DNP project, a 2-sample Z-test for proportions was utilized to understand the significance between the proportions of these two groups of patients. The nominal data included patients who were adherent with the scheduled appointments versus patients who did not, and an independent variable is the peer volunteer calls, whether they spoke to a live person, received a message, or no contact. I would like to share my results for this DNP project on this slide. So there are 2 pie charts shown. Left is live contact reminders, and on the right is no contacts. So as you see on the left, you will see that patients that were adherent to treatment is in green and not adherent is in red. And then on the right, you will see patients that received no contact, and the ones that were still adherent to their treatment is in green and not adherent is in red. As you see on these 2 pie charts, patients that received live contact reminders were much more adherent than those with no contact. So the data did show a strong link between live phone call reminders and treatment adherence. Among patients who received a phone call, 22 of them were adherent and only 4 of them were non-adherent, which yielded an adherence rate of 85%. In contrast, those without a phone call, 19 patients were adherent and 15 patients were non-adherent, which yields an adherence rate of 56%. So this suggests that live phone calls did significantly boost adherence, while lack of calls did result in lower adherence rate. This highlights the potential of effectiveness of using live peer volunteers for treatment reminders. Now I will go ahead with more of the results on this project. So this study just evaluate the impact of live person versus no contact phone call reminders on treatment adherence. So out of the 60 patients, those who received a live call reminder, there showed a proportion of 85%, while those without contact had a proportion of 56%, resulting in a utilization increase of 28%. The z-score was 2.37 with a p-value of 0.08, and then the confidence interval for the difference in proportions ranged from 0.703 to 0.5043. These statistical values did indicate that there is a significant difference favoring live reminders. The achieved power for this project was 78%, which is close to the desired threshold of 0.8. It supports a reasonable likelihood of detecting a true difference if this test was repeated in another timeline. After reviewing the results, I will now discuss how I interpreted the results, starting with the findings. So with the findings, live person reminders did significantly improve medication adherence in newly diagnosed schizophrenic patients, emphasizing that the importance of follow-up care to reduce relapse risk. Next is the live person reminder phone calls, as it did increase medication adherence by 28% compared to no contact reminders. And then next is the importance of it. Live person contact is crucial in supporting treatment adherence for schizophrenic patients, particularly those that are newly diagnosed. And lastly, for mental health follow-up, it is essential for preventing relapse in patients with recent psychotic episodes, reducing the risk of harms to patients and others. Next, I will dive into the discussion of this DNP project. So this portion, we will be discussing the project strength, the weaknesses, the generalizability, and the sustainability of the project, starting with the project strengths. So this project did address a key issue in mental health care, which is high no-show rates and poor treatment adherence. Although there is extensive research on medication compliance, there's few solutions that are effectively tackling this persistent challenge. This project highlighted the role of strong clinic and patient report and how it encourages patients to take responsibility for their care and how to adhere to treatment plans. Another clinic strength was the strong support that this project received from the project site. The clinic's medical director and the program manager provided myself with all of the essential tools and data, which enabled a thorough review of the phone call reminder system, which benefits the patient's adherence rates. Next, I will be discussing the project limitations. This project did face several limitations. Starting off, would be manual extraction was used instead of an automated system, which could introduce some human error. I had to repeatedly review and correct the data to ensure the accuracy. Unlike an automated system where it generally provides more precision, I had reviewed the data approximately 4 times to ensure the data did not have any errors. Another limitation was the small sample size. Although the clinic served thousands of patients annually, hundreds of patients monthly, this study's main focus was on newly diagnosed schizophrenic patients, specifically monitor their medication route and adherence. I also wanted to review which type of route would be best in addition to follow-up reminder calls, but in the initial consultation with Maryville University's statistician, Dr. Pauls, it indicated that this type of precision limited the potential for statistical significance due to such small sample sizes. So while larger sample size would reduce sampling error, extending the study to increase the sample size was impractical, as it would have required additional resources and the time from peer volunteers. Despite the sample size, the project did suggest that patients on long-acting injectables with phone call reminders may attend their follow-up medication appointments more consistently than others. On this slide, I will be discussing the generalizability. If the live phone call reminders did improve adherence in schizophrenic patients, a group that has high no-show rate, this approach may also benefit other mental health populations, such as those with depression, anxiety, bipolar, or personality disorders. Following, I will be discussing about sustainability. With live phone call reminders for medication follow-up appointments, it has been proven effective in improving treatment adherence and could be a lasting strategy for maintaining patient adherence for long-term. Okay. Next, I will move on to implication and how it will impact clinical practice and future research. Treatment adherence remains a major challenge for mental health patients who often have shorter life expectancies than the general population. Improving adherence can reduce psychosis relapse and increase life expectancy. This project did identify gaps in the follow-up care, particularly for schizophrenic patients who may struggle with adherence if clinic and patient rapport is weak. Finding did highlight that the need to enhance medication appointment reminder calls had potential with additional support such as transportation or telehealth assistance. This project emphasizes that building strong professional relationship is key to sustaining adherence, improving patient outcomes, and extending life expectancy. Despite challenges, including the need for an IRB amendment, results did indicate that live phone call reminders can boost adherence, reduce relapse, and enhance patient engagement in their treatment. This approach may guide future research and encourage healthcare systems to prioritize rapport for better patient outcome. Let's continue on with implication and discuss healthcare policy. This project highlights the importance of using peer volunteers for medication appointment reminder calls, demonstrating how this practice can improve treatment adherence and how it can impact patient satisfaction. It suggests that healthcare leaders and policymakers should consider budgeting for dedicated staff to provide live reminders, which can enhance the patient's engagement and their sense of being valued by the clinic and by the healthcare system. While other county-funded clinics have peer volunteers, they typically do not use them for appointment reminders. This project can serve as a model showing that involving peer volunteers in reminder calls can positively impact adherence rates across similar clinics. Now I will continue with implications onto quality and safety. Ensuring quality and safety in mental health has always been priority. Key strategies to improve outcomes include expanding access to care, empowering patients, and addressing mental health stigma to encourage help-seeking behavior. Providing strong clinic support plays a vital role in helping patients maintain treatment adherence, reducing the relapse rates, and minimizing harm to both themselves and to others. On this slide, I would discuss the benefits of this DNP project. The benefits of this DNP project noted that it created a strong professional relationship between patients and the clinic. It does help improve patient outcome by decreasing readmission, ensuring patients receive the care they need not to relapse into their psychotic state and have longer life expectancy. Due to the strong development of clinic and patient rapport, it does encourage the patients to be more involved in their treatment planning, which will also increase patient satisfaction. Lastly, I will talk about the recommendations and how I am concluding this project. This GNP project demonstrated that utilizing peer volunteers for medication appointment reminder calls significantly improved treatment adherence for schizophrenic patients at a Clowney clinic. Unlike other clinics in the system, this site did leverage peer volunteers for reminder phone calls, highlighting a unique approach that could serve as a model for others. Recommendation includes continuing this practice to boost adherence rates, expanding the research to evaluate its effectiveness across other mental health conditions, additionally enhancing the reminder script to address transportation and telehealth technical support needs may strengthen the clinic and patient report and future support adherence. After completion of this DNP project, I was able to answer the DNP question. Follow-up appointment reminder phone calls did in fact increase treatment adherence for newly diagnosed schizophrenic patients. Thank you everyone for your time. If you have any questions, please contact me at my Maryville University email, which is anotieng1@live.maryville.edu for any additional questions. Next, you will see my references. Thank you very much for your time.